My name is Monica Perdomo. I'm a third-year medical student at the FAU Schmidt College of Medicine. Today we'll be presenting a case report, Drug-Induced Liver Injury, a potential side effect of the Pfizer-BioNTech COVID-19 vaccine. Introduction. Drug-induced liver injury may occur due to a variety of substances, including commonly prescribed medications and herbal supplements. However, it has not been reported as a common side effect of vaccinations. Drug-induced liver injury may manifest with symptoms such as malaise, fever, nausea, and vomiting. Per the CDC, common side effects of the Pfizer vaccine include local reactions such as redness, swelling, and pain at the site of injection, as well as systemic reactions such as fever, chills, fatigue, headache, and muscle pain. Liver injury has not been reported as a common side effect of the vaccine. For today's case, we have a 58-year-old female with past medical history of hypertension, varicella zoster, acid reflux, and stomach ulcer, presenting to the emergency room reporting postprandial nausea and vomiting, abdominal pain, fatigue, weight loss, urine discoloration, and yellowing of the skin for 3 weeks. The symptoms began 1 week after the second Pfizer vaccine. Upon further questioning, the patient also reported that she had been taking ashwagandha for an unspecified period of time. On physical exam, she presented with scleral icterus, diffuse jaundice, and right upper quadrant tenderness. On admission, labs showed a total bilirubin of 8.8, an alkaline phosphatase of 227, ALT of 2,693, and AST of 2,176. Ultrasound of right upper quadrant and CT abdomen showed no liver or biliary pathology. The patient was admitted for further management. The following labs were obtained with negative results: hepatitis A, hepatitis B, hepatitis C, hepatitis E, HSV PCR, EBV PCR, CMV, HIV, anti-smooth muscle antibodies, antimitochondrial antibodies, alpha-1 antitrypsin, antinuclear antibodies, and ceruloplasmin. The patient's clinical picture and laboratory results were consistent with drug-induced liver injury from COVID-19 vaccine or ashwagandha use. Given that liver biopsy would not identify the insulting element, it was not performed. The patient was treated with prednisone 40 milligrams when the virology studies came back negative on December 11, 2021. Liver function tests consistently improved with the administration of steroids. The patient was discharged and advised to follow up with hepatology and repeat LFTs twice a week. As seen on these charts, the patient presented with very elevated liver function tests. However, on December 11, 2021, these liver function tests began to improve rapidly with the administration of the steroids. Her total bilirubin also presented at an elevated rate at 8.8. However, on December 11th, they also rapidly improved with the administration of the steroids. Alkaline phosphatase remained elevated but improved throughout her admission. As far as the discussion goes, the patient seen in this case was found to be experiencing drug-induced liver injury with a hepatocellular pattern as evidenced by liver function tests over 3 times the upper limit of normal. Those who are diagnosed with drug-induced liver injury often experience complete recovery when the insulting factor is discontinued. However, in some cases, these may progress to acute liver failure with the need for transplant. The hepatocellular pattern, as seen in this case, has been associated with worse outcomes. One study found that 11.8% of these patients presenting with jaundice may progress to transplant or even death. The case illustrates a potential severe complication of the COVID-19 vaccine. This should not be used to deter those from obtaining vaccination. However, it should be considered in those presenting with similar symptoms after receiving the vaccine. Furthermore, patients should be informed of potential side effects, including rare ones, when receiving this preventative measure. Thank you so much for listening to this presentation. Have a great day.